If you have been waking up at night with your mouth so dry it feels like sandpaper, your body is not just getting older. It may be trying to tell you something that has nothing to do with your mouth at all. And before you tell yourself this is just something that happens when you get older, I need you to hear me clearly. Dry mouth on its own is not dangerous, but what causes it sometimes is, and most people never connect the two. So stay with me for the next few minutes, because by the end of this video, you are going to understand exactly why this is happening and what it might mean for your body right now. Before we go any further, if this is the kind of information you wish someone had told you sooner, please hit that like button and subscribe. This kind of honest, clear health information is hard to find. You deserve to have it, and so does everyone you care about. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health doctor, and I have spent the last 15 years working with patients just like you, men and women over 50 who are trying to protect their health before something goes seriously wrong. Dry mouth is one of the symptoms I hear about almost every single week in my office, and it is one of the most underestimated symptoms in all of medicine. Before I go any further, I want to hear from you. Where are you watching from right now? Are you at home, maybe sitting in your kitchen or your living room? Drop your city or your country in the comments. I read every single one. And honestly, I just love knowing where this community is spread across the world. Now, the condition I am talking about today, the medical term for chronic dry mouth, is called xerostomia, and I want you to hear that word clearly. Because most people in your situation have never been told that persistent dry mouth can actually be a signal pointing towards something else happening deeper in the body. And I know that sounds alarming. I know some of you just tensed up when you heard that. But I need you to stay with me. You do not need to panic. You do not need to be scared. Because I am going to explain every single piece of this to you today. I am going to tell you what is actually going on in your body, what the warning signs are that most doctors miss, and the specific things you can start doing this week to protect yourself. So take a breath. You are in the right place. I want you to do something with me right now while you are still watching. Take 2 fingers and gently press right under your jaw, close to your ears, where your jaw meets your neck. Those are your salivary glands. Just notice how that area feels. Is it tender? Is it swollen at all? Keep that feeling in mind, because it matters for what I am about to explain. Most people think saliva is just there to help you chew and swallow, but saliva is actually doing constant, quiet work in your body every single hour of the day. It washes away bacteria, it protects your teeth from decay, it helps regulate the acid in your mouth, it even contains small amounts of antibodies that help defend you against infection. So when saliva production slows down, you are not just losing comfort, you are losing a layer of protection your body has relied on for your entire life. Think of your salivary glands like a garden hose that has worked perfectly for 60, 70, 80 years. Now imagine someone slowly, quietly starts pinching that hose. At first you barely notice. The water still comes out, just a little less. Over months, maybe years, that trickle gets smaller and smaller until one day you realize the hose barely works at all. That is what is happening inside your mouth, except instead of a hand pinching the hose, it is one of several things happening inside your body. I want to walk you through the most common reasons this happens after 60, and I am going to save the one that surprises my patients the most for near the end. Number 1 is medication. There are more than 400 common medications that list dry mouth as a side effect, including many blood pressure medications, antidepressants, antihistamines, and diuretics. If you are taking more than one prescription, which many of my patients over 60 are, the dry mouth effect can stack on top of itself without you even realizing it. Number 2 is dehydration. As we get older, our sense of thirst becomes less reliable. Your body may genuinely need more water, but the signal that tells your brain to drink simply does not fire as strongly as it used to. So you go through the day mildly dehydrated without ever feeling thirsty enough to do something about it. Number 3, and this is one that catches people off guard, is blood sugar. When blood sugar runs high, your body pulls extra fluid out of your tissues, including your mouth, in an attempt to flush out the excess sugar through urine. Many people with undiagnosed or poorly controlled type 2 diabetes experience dry mouth as one of their very first noticeable symptoms, long before they ever get a diagnosis. And now I want to show you something that genuinely surprised me when I first started seeing this pattern in my own patients. For a meaningful number of people, especially women over 50, persistent dry mouth combined with dry eyes is one of the earliest signs of an autoimmune condition called Sjogren syndrome. In this condition, the body's own immune system mistakenly attacks the glands that produce moisture, including the salivary glands and the tear glands. It often develops slowly, quietly, over years, and dry mouth is frequently the very first clue, long before any other symptom shows up. Think of your immune system like a fire alarm system installed throughout your entire body. Its job is to detect real threats and respond. But sometimes, especially as we age, that alarm system gets confused. It starts going off even when there is no fire. And in conditions like Sjogren syndrome, the alarm keeps sounding directly at your own moisture-producing glands, slowly damaging them over time, even though there was never a real threat there to begin with. Let me tell you about a patient of mine. Her name was Margaret. She was 64 years old, a retired school librarian, and for almost 2 years she had been waking up at 2 or 3 in the morning needing water just to fall back asleep. She thought it was just part of getting older. She joked about keeping a water glass on every nightstand in the house. What Margaret did not know was that her dry mouth had quietly been joined by dry, gritty feeling eyes, and a kind of fatigue she could not explain. When she finally mentioned all 3 symptoms together during a routine visit, her blood work led to a diagnosis of Sjogren syndrome. She told me later that if she had known dry mouth alone could be a clue, she would have brought it up 2 years earlier. And here is something I want to say plainly, because I think it needs to be said. Our healthcare system is largely built to treat illness once it has already fully arrived, not to catch these quiet early signals. Prevention does not generate a prescription. It does not generate a follow-up appointment. So a symptom like dry mouth often gets brushed aside as minor, simply because there is no clear billing code for catching something early. That is not a conspiracy. It is just how the system is structured, and it means the responsibility often falls on you to notice these patterns and bring them up yourself. I want to stop here for just a second, because if you have someone in your life, a husband, a wife, a brother, a sister, a close friend, a neighbor over 60, and what I just described sounds like them, please share this video with them right now. You might be doing something that saves their life. I am not exaggerating. Send it to them. Show them this. It takes 10 seconds, and it could change everything for them. And if you have not already, please subscribe to this channel. I make these videos specifically for people who want real answers instead of being rushed through a 10-minute appointment. Every subscriber tells me this kind of honest information matters, and that keeps me making more of it. I want to ask you something personal, and I hope you will answer. How old are you, and does any of what I have described so far sound familiar to you? Does it sound like something you are going through or something someone close to you is dealing with? Tell me in the comments, because your answer helps me understand what this community needs, and it helps me decide which video I am going to make next. I make every video for you, so tell me what you need. Now stop for a second, because what I am about to tell you changes how you should be looking at this symptom from now on. Dry mouth is rarely just about your mouth. It is one of the few symptoms in medicine that can point in several different directions at once, toward your medications, toward your hydration, toward your blood sugar, or toward your immune system. That is exactly why it gets dismissed so often. It does not point to one obvious answer the way chest pain or a broken bone does. It requires someone to actually stop and ask the right questions. And I want to be very clear with you. Most people who experience dry mouth after 60 do not have a serious autoimmune condition. Many simply need a medication review, better hydration habits, or a conversation with their doctor about their blood sugar. The goal of this video is not to frighten you. It is to make sure you do not dismiss a symptom that deserves a real conversation with your doctor. So here is exactly what I want you to do, starting as soon as this video ends. Number 1. Write down every medication and supplement you currently take, including over-the-counter ones, and bring that list to your next doctor's visit specifically to ask about dry mouth as a side effect. Number 2. Track how much plain water you are actually drinking for 3 days. Most people are surprised by how little it really is once they write it down. Number 3. Pay attention to whether your eyes also feel dry or gritty, especially in the morning. If both your mouth and your eyes are dry, mention both symptoms together at your next appointment, because together they carry more meaning than either one alone. Number 4. Ask your doctor for a simple blood sugar check, especially if you have not had one in the past year, even if you feel generally fine otherwise. Number 5. Avoid mouthwashes that contain alcohol since they can make dry mouth noticeably worse, and consider keeping water nearby throughout the day rather than only when you already feel thirsty. Number 6. If your dry mouth has lasted more than a few weeks, do not wait for your next routine physical. Call and mention it specifically, using the words dry mouth so it gets addressed directly instead of getting lost in a longer list of concerns. Before I close out today, I want to know something. Is what I described in this video something you are dealing with personally? Or do you know someone, a spouse, a sibling, a close friend, who might be going through this right now? Tell me your story in the comments. And if you want me to make a video on something specific that you are dealing with, something your doctor has not explained clearly, ask me. I read every comment. I take requests seriously. Your question might become the next video. Thank you so much for watching this video all the way through. If it helped you understand something about your own body a little better today, please subscribe so you do not miss the next one. This community means a great deal to me, and the more of us who understand these warning signs, the better we can take care of each other. Everything in this video is for educational purposes only. I am not your personal physician, and this is not a substitute for a proper medical evaluation. If anything I described today sounds like your situation, please talk to your own doctor. But now you know exactly what questions to ask, and that is the point.